Every Singaporean will be covered for life under Singapore's new compulsory health insurance scheme called MediShield Life. The scheme includes people with pre-existing conditions. Premiums will go up, but it will largely be covered by the 1 percentage point increase in employer MediSave contributions. So the majority can pay for the premiums out of their MediSave. We'll have all the details on this extended edition of News 5. We start off now with the recommendations of the MediShield Life Review Committee, released after months of consultations. The aim is to provide better benefits and ease concerns over large hospital bills. Patients will soon pay less, as there will be higher payouts from MediShield Life.
We'll come to the
Some of the recommendations by the committee include increasing claim limits and lowering the amount one co-pays for insurance. The claim limit is the amount claimable from MediShield, which is dependent on the number of days a patient is warded and the type of surgery performed. But before MediShield kicks in, a patient has to pay using MediSave or cash what is known as the deductible. All amounts above the deductible up to the claim limit is split into two. The co-insurance portion, which is up to 20%, while the rest is covered by MediShield. So if the claims limits are increased and the co-insurance lowered, it would result in more being paid out, which means the out-of-pocket expenses for patients will be lowered. In March, the MediShield Life Review Committee had proposed to remove the lifetime claim limit of $300,000, increase the daily claims limit for intensive care unit and normal wards, as well as increasing the claims limit for outpatient cancer chemotherapy and radiotherapy treatments. So the committee recommended increasing daily claim limits for normal wards from $450 to $700 and $900 to $1,200 for intensive care unit wards. Reducing inpatient co-insurance from 10 to 20% to 3 to 10%, and outpatient co-insurance from 20 to 10%, and raising the annual claim limit from $70,000 to $100,000. With the new scheme, co-insurance will be reduced and maximum claimable limits raised to enable more to be paid out of MediShield Life. Under the current scheme, 8 in 10 subsidized patients pay less than $3,000 for their Class B2 or C inpatient bills. But under MediShield Life, 9 in 10 will pay less than $3,000. For those with very large Class B2 or C inpatient bills, 1 in 10 will pay less than $3,000 under the current scheme, compared to 6 in 10 under the new scheme.
So how do these proposed enhancements help patients? Here's a look at two examples, a stroke patient and another who's undergone cancer treatment.
48-year-old Mr. Yi is a stroke patient who had been hospitalized for 14 days, including a 4-day stay in the intensive care unit. After government subsidies, the bill amounts to $10,100. Under the existing scheme, the maximum coverage allowed is $8,100. But under MediShield Life, now the maximum coverage has been lifted. The deductible remains unchanged at $2,000 for a Class B2 ward. Co-insurance lowered from $810 to $553. Under the existing scheme, the current MediShield payout is $5,290, compared to $7,547 with the new MediShield Life. This means that Mr. Yi will pay about $2,500 compared to $4,810. Under MediShield Life, he will pay 25% of the total bill as opposed to 48%. Another example is 63-year-old Madam Kamla, who had 4 cycles of cancer treatment. After government subsidies, her bill was $6,800. There's no deductible for outpatient treatments. Co-payment reduced from $1,840 to $680. So the payout under MediShield Life will be $6,120 compared to the current $4,960. In this case, MediShield Life will pay 90% of the remaining bill instead of 73%. For out-of-pocket expenses, Madam Kamla has to fork out $680. $1,160 less than before. That's 10% of the total bill compared to 27%.
Let's take a look now at how the MediShield Life Review Committee arrived at its recommendations. The committee says it had to carefully consider the balance between benefit enhancements and the affordability of premium. Those were the key principles guiding discussions. First, the importance of MediShield Life as an insurance to give Singaporeans peace of mind against large medical bills. For example, making sure that the bills up to the 90th percentile are covered. That means ensuring that 9 in 10 Singaporeans admitted to B2 or C class wards are fully covered by MediShield Life. The other guiding principle was premium affordability.
More than 1,200 Singaporeans have participated in 36 dialogues and focus group discussions, sharing what they hope to see in MediShield Life.
And participants had expressed a variety of views. These include concerns about premium affordability at old age and out-of-pocket cost even after insurance coverage. At the same time, participants had also expressed the desire to see more benefits. So the committee said a balance had to be struck.
Many Singaporeans know they can't have everything. And there's a need to balance and to prioritize. Having all the requests would mean premiums would have to increase significantly. We all agreed that MediShield Life had to strike a balance with premium affordability. We have to focus on the most meaningful enhancements that benefit Singaporeans as a whole.
The committee said one of the most intense discussions was on trade-offs in certain areas. This includes whether to lower deductibles to improve benefits or to raise the claim limit and reduce co-insurance instead.
Yes, we realize reducing deductibles will have large impact on premiums. Many more bills will be claiming payouts from the fund. In comparison, raising claim limits and co-insurance will benefit the largest bills where out-of-pocket payment is of greatest concern. And therefore, it's more critical to focus on enhancing protection for the large bills that cause Singaporeans to worry, which are most difficult for us to plan and save up for.
The committee also said it had decided against the idea of a no-claim bonus, as that would have also meant premiums would need to increase.
You are effectively funding your own no-claim bonus. We also do not want to recommend or encourage people not to claim when they are ill, just to maintain or not to flout to entitle them to get the no-claim bonus, because that is not the right thing to do. And when you're sick, you go to hospital, you go to get medical attention. But having said that, you want to add that in, the premiums are going to go up.
The committee said that in its final report, it will be recommending that the government promote healthy lifestyles through other channels instead. It will be finalizing its recommendations and premium details over the next month.
The recommendation is that there should be no more than a 3% premium increase for existing MediShield policyholders, and the cost of the scheme of universal coverage will be shared, with the government bearing most of it.
Today, not everyone can buy medical insurance, not if you have an existing condition such as kidney disease. But under MediShield Life, everyone will be covered, including those with pre-existing conditions. However, this universal coverage will come at a higher cost, which will be shared among the government, policyholders and those with pre-existing conditions. MediShield Life Review Committee says the government is expected to fund more than half of the cost, while the premium increase for policyholders should be no more than 3% from current premiums. The committee says those with pre-existing conditions will have to pay higher premiums reflective of their higher risks at an additional 30% for 10 years, and thereafter they will pay normal premiums relevant to their age group.
We think is only equitable and fair to the other existing insured. The committee had to balance, on one hand, not to have too onerous an amount loaded on this group of people. On the other hand, Singaporeans coming together to pay a small amount of 3% to help in this risk pooling.
The other recommendation is to start premium rebates earlier, from 66 years old instead of 71.
We felt that 66 is the age where people, even with the re-employment of Singaporeans, is the age, where you will not be working. You may not have employment income. to help pay for the premiums. And that is a time when you should be getting a rebate to cushion the increases in premiums when you grow old.
To that end, the committee has proposed adding a new age band of 66 to 70, which will enable Singaporeans to enjoy premium discounts earlier. And like the existing structure, those who sign up when they are younger will enjoy more rebates. Currently, rebates are given to make premiums more affordable for older insured members who joined the scheme before age 60.
The MediShield Life Review Committee also notes that based on typical household types, no additional cash outlay is required as the household premiums will remain within MediSave contributions. Here's a look at another example.
A working couple in their mid-30s with a combined income of $8,000 and MediSave contribution of $720 a month, their premiums would amount to $18 a month under the current MediShield scheme and will go up to $22 with the new MediShield Life scheme. And if the couple has 2 children, that will be an additional $10 of premiums, up from $8 under the current MediShield scheme. For their retired parents, premiums will be at $78 a month under the new MediShield Life scheme, up from the current $76 a month. All in all, the indicative premiums for the whole family will be $111 per month after premium and first-year transitional subsidies. And when the transitional subsidies are phased out after 4 years, the indicative premiums will be $147 per month. This is expected to be well within the family's monthly MediSave contribution of $720.
So this brings us to the question of how much you would have to pay for premiums. Details are still being worked out, but the MediShield Life Review Committee noted that with improved benefits and lifelong coverage, premiums will have to be increased to support additional payouts. We do know, though, that the additional 1% contribution by employers to MediSave, which kicks in next year, will be sufficient to cover the higher premiums for most people. This means that household premiums will remain within MediSave contributions with no additional cash outlay required.
Singaporeans will experience enhanced benefits when MediShield Life begins in 2015, and that's one of the reasons behind the higher premiums expected. Premiums will also go up because Singaporeans will bear a small part of the cost incurred when MediShield Life protection is extended to those with pre-existing conditions. But the bulk of the cost, or more than half, will be borne by the government.
It's a community approach. There's an element of inclusiveness. And we want to base it on the elements of shared responsibility and inclusivity, but always remembering to balance this with premium affordability.
Another reason for higher premiums, Singaporeans will pay more during their working years to cushion premium increases that will come as they age. Premiums typically increase as one gets older, causing worry over such costs in retirement years. But with MediShield Life, paying for such premiums ahead of time during one's working years will mean that premium increases are less steep during retirement.
Final details of MediShield Life premiums will be released at a later date, as the committee says some fine-tuning still needs to be done. But the government has already said that there will be help for Singaporeans, especially the lower and middle income, as well as the elderly.
These support measures encompass premium subsidies for the pioneer generation. These will also apply to low and middle income households, which account for up to 2/3 of the population. Transitional subsidies will also be provided for 4 years to ease the shift to MediShield Life. Lifetime MediSave top-ups will also be part of the Pioneer Generation package, and those between 55 and 64 years of age will receive top-ups for 5 years. The committee says that regardless of the quantum of increase in premiums, it's the affordability that counts.
Whether it's double, whether it's triple or quadruple, no, doesn't matter. Whether it's 1.5 times or not, the key thing is it affordable? Okay, from the top up by the government, from the subsidies to be given the government.
The ministry will finalize the government subsidies and provide details at a later date.
Observers we spoke to say the recommendations address long-term healthcare concerns, as healthcare is increasingly moving out of the hospitals. They noted that the MediShield Life Review Committee has also recommended increasing claim limits for community hospitals and outpatient cancer treatment. Others say the proposed higher premiums for existing policyholders due to the universal coverage is a reflection of a collective responsibility as a society.
We want to take care of everybody, and we want everybody to be able to share the burden of taking care of everyone as well. This social compact, if it could be upheld, it will actually keep society together, and it actually makes society even warmer in that sense, and more caring and more inclusive.
I think that it's great that the government has made a commitment that it will fund the bulk of the increase in premiums necessary to cover those who have not previously been covered, with the assurance that the existing policyholders will see premiums rise by not more than 3%. Right? It would be very helpful if the government shared some of its projections as to what is the expected impact on the public purse. Is it 20 million a year? Is it 50 million a year?
The Life Insurance Association of Singapore says there will be minimal impact on the premiums for the private insurance component of the integrated shield plans. The private insurance portion provides additional benefits beyond MediShield coverage and can include treatment in private hospitals and Class A B1 wards in restructured hospitals. In a statement, the association says private insurers will also continue to monitor and manage the impact of medical inflation in ensuring that their plans remain competitively priced and affordable. The association adds that the life insurance industry is encouraged by the review committee's efforts to provide greater protection for Singapore residents with MediShield Life. Here's what you can expect next. By the end of June, the committee will finalise its recommendations and premium details on MediShield Life. And in early July, the government will respond and share details of the finalised premiums and subsidies.